So welcome everyone. So delighted to see so many people join us here for the launch of the Irish Health Behaviour in School-Age Children study. Delighted to have so many people here. And in fact, we were really overwhelmed with the number of people who registered. So many thanks for showing up today. I think it's testament to the interest in child and adolescent health, which is excellent to see. So for those of you who don't know me, my name is Colette Kelly. I'm a Professor of Health Promotion at the University of Galway and joint principal investigator of the HBSC study. Many of you will know and have been friends with Ciarán, who's currently on sick leave, but I was in touch with Ciarán yesterday and she did say she'd love to send on her regards to everyone. She's doing well. So just wanted to let everyone know that. So delighted to have so many people here, and I'll just go through maybe the running order of the event for everyone, just so people are familiar and know what to expect. I will introduce people who are on the panel, you know, as they're going to speak. So you'll get to see some of the team because there are many people involved in this study. So the running order, we will have the official opening from our president of the university, and we will then move on and we'll have a few words from the Department of Health, a pre-record from Minister Colm Burke, and then we'll have I suppose the main event, Aoife Gavin, who is the lead author on the report. She will then present the findings. So just to let everyone know, the presentation itself will be recorded, and then we will make that available on our website in due course. So just to let everybody know that so they can listen back as well. We will have some hashtags on the first slide as well. So please do share, you know, findings and things that are of interest to you on your social media platforms or other platforms as well. We will make the link of the report available to you as well, so you can browse that at your ease as well. There will be a question and answer function as well, so please do put in your questions, and we will have a question and answer session at the end. We'll get to as many questions as we can. I know time can be tight on these things, but you know, please do contact us again in the future, and we'll do our best to get back to you. So before I pass over to the president, I do just want to have I suppose a few words of thanks, not to everybody here or the team, really just to the children, I guess, who took part in the study. We will have a number of thank yous at the end, but you know, really without them, we wouldn't be here. So really all the children and adolescents in Ireland who took part in the study really appreciate, you know, their volunteering for this. But also we have young people involved in our study in many different ways, including deciding on what questions should be in the study, to what should be in the report, and what we should be focusing on and what's important to their lives. So just really wanted to thank them. So I think what I'll do is I'll just pass over to our president, Ciarán hÓgartaigh. Thanks, Ciarán, just to welcome everyone officially. And then Ciarán, I'll introduce Fiona then after, if that's okay. Thank you.
Thank you very much, and thanks, Colette, for the introduction. And it's my role just to first of all formally thank all our colleagues and all those involved in the research on behalf of the University of Galway, Galway. As Colette has mentioned, this is really important work. Many people have been involved, both from within the university and more broadly. And first of all, I'd like to say thank you, we really appreciate your participation. And it's really in keeping with the University of Galway's values. We have in our previous strategic plan, current strategic plan, we've committed to being for the public good. And I see this research as particularly being in keeping with that value, that purpose that we have of being here as a university for the public good, and the sense that this has policy impact, and this will, as evidence, will make a difference in policy, and therefore in the lives of young people who then become the citizens of the nation, if you like. So this is a particularly important study, given its scope and its scale across time. Secondly, it's really consistent with our values. So we also committed to having values of respect, openness, excellence, and sustainability. And to me, this clearly respects this area of research, respects the evidence, which is really important for us to have evidence-based research and having that sense of respect for research in itself and the value of the evidence base. And clearly here, the number of participants, the scale, the work done, and the questions asked clearly has respect and for that evidence and that sense of looking to extend the impact of our research based on evidence. Secondly, excellence, and that again is high standards. That sense of the number of children, students who have been involved over a period of time. So my understanding is more than 9,000 children from a representative sample of 191 primary and post-primary schools nationwide. And the sense that asking to report a series of questions relating to lifestyle, behaviours and experience, this again is that sense of high standards in the work done. And the scale of the work done and the effort in doing that. And then sustaining the next generation. So we often think about sustainability in the context, quite rightly, of climate action. But when we look at the Sustainable Development Goals, where Galway has a particular leadership role, many of those are to do with that broader sense of sustainability. And to me, as universities, part of our role is to sustain the next generation. And the questions asked around health, around behaviour, around experience, lifestyle, all of those elements are really to get a better understanding of those experiences, and then to have support for sustaining the next generation and good health on the next generation, because it starts in that school age population, and that makes a difference then over time, not only to them very profoundly, but to society more generally. And finally, that value of openness. So here we're opening up the research, if you like, but what Colette mentioned about engaging the students themselves and the children themselves in what questions should be asked. So that sense of openness in the research, that we're open to questions, we're open to design and redesign. Public patient involvement in research is something we're very keen on. And again, this research fits very nicely with that sense of openness, that we want to engage early and we want to get that information early. So Cogordas Levidig, Tommy Donna Hoss leis an obertá déinte an a bhuaigtí vilig. Ein lomadini le lua, so Jeremy Gormak le Quilliguna, Ton Oberdaint, Gwillan Oberdaintaka, agus Tommy Donna Vrodu las an Ober, agus Gamafada Boon Shiv, agus Gamafada Boon should be Winterclash fresh in the Poshi Winterclash, Tushkin Obertá déinte. Thank you.
Thanks, Ciarán, appreciate that. So I'd like to introduce Dr. Fiona Mansergh. So Fiona is from the Department of Health and Wellbeing in the Department of Health. And the Department of Health have actually funded the HBSC study for our 7 consecutive rounds. So really grateful for that support. But not just in terms of the funding, really, I suppose the constructive discussions and debates, I guess, we've had about child and adolescent health that has really helped to mould and shape the study as well. So really grateful to the department and Fiona. So I'll just hand over to Fiona to say a few words. Many thanks.
Míle fáilte, and hello everyone. I'm Fiona Mansergh from Healthy Ireland in the Department of Health, and I'd like to take this opportunity to welcome everyone to this launch of the Irish Health Behaviours in School-Age Children study in 2022. So as you all know, HBSC is an international study which was carried out in 51 participating countries and regions in conjunction with the World Health Organization. So this study enables us not just to look at how we're getting on here in Ireland, but also to compare and contrast with how other nations are getting on as well. We're delighted to be able to support Ireland's participation in HBSC. Ireland's been a member since the late 1990s, and every wave gives us an ever greater opportunity to monitor the health and wellbeing trends in our children and young people over time, and to look at policy responses to any issues that come up. So HBSC is one of a number of important surveys we conduct. We also do the Healthy Ireland survey, and other parts of the department look after TILDA and so on. And these collectively provide both this department and the wider areas of government with really valuable information about the health of our young people and people of all ages, in fact. And this is information on which we can then base policy decisions that help to safeguard and promote our children's health and well-being in the case of this study. So all these studies are incredibly valuable to government. So huge thank you to everyone involved, our expert team in Galway, and also to the schools and to the young people who participated in this study. So we really appreciate your help. So just to add, in terms of the Q&A after the presentations, for any questions, for any journalists who are present, that if they would like some more detail in terms of a response to any questions that you might have around government policy responses to the findings presented in the report, please contact press_office@health.gov.ie, and our press office will be delighted to help with more detail in terms of how we are supporting our children and young people with reference to issues raised through the report's findings. And I'd now like to introduce a pre-recorded speech from our new Minister of State for Public Health, Wellbeing and the National Drug Strategy, Burke TD, who is supporting this event. So over to Colm. Gura míle maith agaibh go léir.
Ladies and gentlemen, good morning. I'm delighted to address you today as we launch the Health Behaviours in School-Age Children report. The research team will take you through the findings in detail. I'm very conscious that our children and young people are relying on us to create a future where their health and well-being are protected. So I want to briefly highlight the work we're doing to support that aim. And the HBSC report is a vital tool in informing this work. I'm pleased to see that a reduction in alcohol and drug use, but the data reflects a clear need to continue our efforts to reduce alcohol and drug-related harm. Last year, under our National Drug Strategy, Reducing Harm, Supporting Recovery, we launched a 1.5 million drug prevention and education funding scheme. Funding initiatives that engage with people who may be at risk of using drugs in a variety of contexts, including schools and communities. Our Public Health Alcohol Act aims to reduce alcohol consumption, delaying the age at which young people start drinking alcohol and regulating its sale and supply. Anti-smoking campaigns, smoke-free initiatives and educational programs have made huge strides in reducing tobacco use among young people. The rise in popularity of e-cigarettes has posed new challenges, but these are being addressed by the Public Health Tobacco Products and Nicotine Inhaling Products Act, which has banned the sale of e-cigarettes to under 18s. Further measures come into effect later this year, including a ban on the advertising of nicotine inhaling products in areas close to schools, on public transport and in cinemas. Looking at the data in today's report, we must remember that the fieldwork was completed in the first half of 2022, when children were still adjusting to life after a long period of COVID restrictions. The pandemic had some positive impacts for our young people, particularly on family relationships and physical activity. However, it also had a negative effect on mental health and school performance. Other research in this area paints a similar picture, showing a concerning decline in our physical and mental health and well-being post-pandemic. This department, the HSE, and our colleagues in the Department of Education are working hard to support young people's mental health. Record investment in mental health has supported a range of service improvements. Budget 2024 provided a record 1.3 billion for mental health. In addition, earlier this year, Minister Butler announced a further 10 million in funding to support clinical programmes with a specific focus on youth mental health. Our colleagues in the Department of Education have enhanced and redeveloped many resources for schools, including additional supports to the National Educational Psychological Services, guidance, counselling, student support teams and online resources. The Ciarán Action Plan on Bullying aims to prevent and address all forms of bullying in schools. Our landmark free contraception scheme has now been in operation for 18 months, providing young people aged 17 and older with free access to contraception without cost barriers. In addition, the HSE provides information supports and services through the excellent sexualwellbeing.ie website. Menstrual health and period poverty are also areas of concern. This department and the HSE fund period poverty initiatives through community health organisations, local authorities, family resource centres and other community partners. I will also take this opportunity to say that help is available where period pain is a barrier to participating in normal school, sport and social activities. We have opened new gynecological clinics and endometriosis services under our Women's Health Action Plan. These are just a few of the many areas in which we are working to effect real change, creating positive, healthy environments in which our children and young people can thrive. To sum up, I want to reiterate that while the HBSC report shows a complex and ever-moving landscape, we will always strive to address issues faced by our young people through effective policy. I would like to thank the team at University of Galway for their hard work and my colleagues in the department for their work in managing and supporting it. Finally, and most importantly, thank you to the many young people who took part in the survey, contributing to make it such a valuable resource. Go raibh míle maith agaibh go léir.
Okay, thanks. And I guess we're on to the sort of the main event. So it gives me great pleasure to introduce Aoife Gavin. So Aoife is our senior researcher on the HBSC study. Aoife and I have worked together for many years. So Aoife is the first author of this national report. So she's going to present some of the findings. She has been our survey manager and our data analyst. So she's going to take you through the main findings, and then we will have time, as I said, at the end for question and answers. So please do put your questions into the question box, and I'll hand over to Aoife now. Many thanks, Aoife.
Right, thank you, Colette, and thank you everyone for joining us on behalf of the HBSC team in Ireland. We are delighted to see such a high level of interest in our report today. And as the lead author of the report, I have the pleasure of sharing with you this morning the main findings, but it would be remiss of me not to acknowledge the co-authors on this report, Andreas Coto, Louise Lunny, Rachel Maloney, Larry Walker, Professor Ciarán Gavin, and Professor Colette Kelly. So before I start, I would just like to remind people that we'd really appreciate any shares on social media using the hashtags that are on screen: HBSC Ireland, hashtag Child Health, and hashtag Adolescent Health. My presentation this morning, so I'm aware we have a variety of participants joining us on today's webinar. Many of you will be quite familiar with the HBSC study, but for some it may be your first time hearing about this study. So I will give a brief background on what the study is all about. I'll discuss the 2022 methods, and then of course the main event, bring you through the key findings that are being published in today's report. So the Health Behaviour in School-Aged Children study, or the HBSC study, is a cross-sectional design research study. So cross-sectional meaning that we're providing a snapshot of children's lives. The study itself is carried out in collaboration with the World Health Organization Regional Office for Europe. It's an international study that's carried out every 4 years. And in 21-22, there was 51 participating countries and regions across Europe, North America, and parts of Asia. Ireland has been a member of the International HBSC Network since 1994, having first collected data in 98. And in 2022, it was the 7th time that we've collected data from school-aged children in Ireland. So to date, we have collected data from over 80,000 young people across Ireland. The main aim of the HBSC study and its research network are to deepen our understanding of adolescent health within the social context, to inform health promotion policies and practice at both national and international levels, and to foster collaboration among researchers, policymakers, and practitioners, all who are present in today's webinar, in Ireland and across participating countries. The study itself supports evidence-based decision-making and the development of targeted interventions to promote positive health outcomes and reduce health inequalities among young people. HBSC Ireland strives to improve the lives of children We like to use this conceptual model to illustrate the aspects of children's lives that our study investigates. In particular, we're interested in understanding the context in which children live, be it their family, their school, their friends, their health behaviors and health risk behaviors, as well as many health outcomes, both positive and negative. The study itself is a school-based survey, so the data is collected through self-completed questionnaires, which is administered by teachers in a classroom setting. The questionnaires are made up of the questionnaire is a standard questionnaire, which is developed by the International HBSC Network. So within the Irish questionnaire, there are a suite of questions, including mandatory international questions. So this means questions that are asked in all of the participating countries. There's then optional international questions, as well as national specific questions. This is often in Ireland as a response to policy and program needs. So we work collaboratively every 4 years to determine specific policy program needs, and we work with the department and their advisors to help shape the specific questions included in each round. We collect data from children in 3rd class in primary schools to 5th year in post-primary schools. So in 2022, we collected data from 191 primary and post-primary schools, representing a 51% response rate of invited schools. I guess it's worth noting that the HBSC 2022 was a particularly challenging time to collect data from schools. As you can appreciate, schools had just reopened post-pandemic. So I guess to acknowledge and appreciate that the teachers and schools and management authorities that did allow HBSC study to be carried out within their schools. Overall, we collected data from 9,071 pupils. For the first time in 22, we provided the option of both an online and the paper and pen questionnaire. Online, we used the Qualtrics platform, and the paper and pen would have been posted to the schools. Overall, 58% of schools opted for the traditional paper and pen questionnaire, with 42 opting for the online. It's worth noting as well, primary schools were far more likely to opt for the paper questionnaires, and post-primary schools were far more likely to opt for the online. Just to note in the report, the overall percentages presented are weighted using sample weights calculated with the CSO 2022 data, and this is to account for any gender and regional imbalances. So the report itself is broken into 2 sections. The first section is the main study, what we call our main study, and this focuses on the 10 to 17-year-olds. In this section of the report, there's 14 different sections with 48 indicators. I guess I'm pointing this out today. My presentation is actually only going to touch on 14 of these indicators, so I do encourage people to go and download the report and spend time looking through the report, because there's far more information available than what I'll be presenting on today. We also have a section on the middle childhood study. So this is our 3rd and 4th class pupils. Just to note what's new in HBSC 2022. So for the first time, we've asked a question around loneliness. Sun safety behaviors was actually asked in 2018, but for the first time, it's being reported in our national report. We've also, for the first time, asked questions around menstrual health and period poverty, which I'll present on. And it, of course, would have been remiss of us not to ask questions around COVID-19, the impact of COVID-19 and its associated measures. As Colette mentioned previously, youth engagement is a fundamental aspect of the HBSC Ireland study, and we acknowledge the importance of young people's involvement in all stages of the research process. In saying that, in the spring of 2023, we carried out youth engagement workshops in both primary and post-primary schools. Students worked together to agree on priority health topics for this report, and the rankings are illustrated here, which show mental health as the top rated priority among young people. The ideas that were generated by the young people during these workshops really did help to shape the report that's being published today. So before I move into sharing the findings from the report, I just thought I'd take a minute to explain how to read and interpret the report itself. So on your screen, you can see this is just a screenshot of one of the indicators. This is excellent health that I'm showing. The overall percentages for each of the indicators are contained at the beginning of the report in the overview. So that's where you'll find the overall percentages comparing 2018 to 2022. Then for each of the indicators, you'll find a page very similar to this. And on this page, you'll find gender, age, social class, and differences between 2018 and 22. So at the top is the graph illustrating the boys' percentages. At the bottom is the girls. The orange bars represent the 2018 data, the blue bars representing the 2022. The social class data, you can see, so social class 1 to 2 is the highest social class. Social class 5 to 6 is the lowest social class. So you can see that gradient in the colors. As well, there are the 3 age groups. So we present our data by 10 to 11, 12 to 14, and 15 to 17-year-olds. As well, in the text at the top of the graph is where you will find a comment on whether the differences by age, gender, and social class are significant or not. I guess it's just important in saying maybe on first view, the graphs are quite simple, but there is quite a lot of information that you can get from investigating each of the indicators on their own. Okay, so what we're all waiting for, the key findings from the HBSC 2022. So as I mentioned, I'm only going to be presenting on a subset of these. There's 14 indicators that I'm going to present on today. Like I said, I do encourage you to go to the report and have a look at everything that is included. To begin, so general health and well-being. So the first indicator I'm going to look at is life at present. And this is where young people were asked how happy they feel about their life at present, with response options varying from I feel very happy, I feel quite happy, I don't feel happy, I don't feel happy at all. The findings presented here is those who report feeling very happy with their life at present. So on your left is the boys and on your right is the girls. Overall, in 2022, 28% of children report feeling very happy with their life at present. This is a notable decrease from 42% in 2018. Boys, younger children, and children from the highest social class groups are far more likely to report feeling very happy with their life at present. The next indicator is the WHO-5 Wellbeing Index. So this graph here is only representing the 2022 data, so it does look a little bit different from the last graph. This measure is a 5-item positively worded scale, which provides us with a measure of emotional functioning. So participants are given a score between 0 and 100. A score below 50 indicates a low mood, and a score below 28 indicates a risk of depression. What we can see here in this graph is the vast majority of children in Ireland are reporting positive mood, which is welcome. I would like to draw your attention to the girls, and particularly the older girls, who are more likely to be classified as low mood and risk of depression. There is a significant gender difference in reporting low mood and risk of depression, with 26% of boys compared to 46% of girls. Like I mentioned, loneliness is a new item in 2022, so there is no 2018 data to compare. Overall, 15% of boys compared to 26% of girls report feeling lonely most of the time or always in the last 12 months. And children from lower social class groups are significantly more likely to report feeling lonely. Moving on to the next section of the report, I'm going to look at the risk behaviours. So the first one is reporting ever smoked cigarettes. HBSC Ireland has reported on cigarette use since 1998, and 2022 continues to demonstrate a decreasing proportion in young people reporting that they have ever smoked cigarettes. The proportion was 12% in 2018 and it's now 9% in 2022. Girls and older children are more likely to report ever smoking cigarettes, with 10% of girls and 8% of boys. However, e-cigarette use is now more common than cigarette smoking, with 18% of young people reporting that they have ever used an electronic cigarette or a vape, with 13% reporting that they had used a vape in the last 30 days. What we're reporting today is that we're seeing an increase, particularly among the girls aged 15 to 17, reporting that they have ever used a vape compared to 2018. However, it is important to note that this data was collected in the spring and autumn of 22, prior to the ban on the sale of e-cigarettes to under 18s. So this is one area that we will be interested in seeing the findings from the 26 data collection to see the impact of that ban. Next is the measure around never having had an alcoholic drink. A welcome here is an increase in the proportion of young people who report that they've ever had an alcoholic drink. However, of note, across all alcohol measures, girls are more likely to report alcohol consumption. So this is reporting having had a drink in the last 30 days, reporting ever been really drunk, and reporting drunkenness in the last 30 days. This is very much in line with international findings, girls reporting a higher proportion of engagement with alcohol. Finally, in the risk behaviors is cannabis use. So here we've seen a decrease in the proportion of young people reporting cannabis use in the last 12 months. In 2018, the proportion was 8%. In 2022, it is now 6%. Older children are more likely to report cannabis use, and there's no gender difference in this indicator. Moving on to food and dietary behaviors. Looking at consumption, here we can see that there is an increase in the proportion of young people who report that they eat fruit more than once a day. So 1 in 4 children are reporting that they eat fruit once or more a day, which is an increase from 2018. Similar finding for vegetables. Of note, children from higher social classes are significantly more likely to report eating fruit and vegetable. Soft drink consumption remains unchanged at 7% between 2018 and 2022. Young people are asked about eating breakfast on weekdays, so school days essentially. What we see here is an increase in the proportion of children who report that they've never had breakfast, that they never have breakfast on weekdays, from 13% in 2018 to 19% in 2022. There's significant gender differences, 14% of boys compared to 24% of girls. Older children are more likely to report not eating breakfast on weekdays, and it's evident in this graph here, the social class gradient. So in general, there's a significant difference with those in the lower social class groups more likely to report not eating breakfast on a weekday. Moving on then to exercise and physical activity. So the national guideline around physical activity for young people under the age of 18, the recommendation is that they engage in 60 minutes of moderate to vigorous activity for 60 minutes every day. So this item is asking children about their levels of physical activity on the last 7 days in the previous week, The findings in this graph represent children who report being physically active every day in the last week. Bear in mind, this is the recommendation for children under 18. However, only 24% of children report being physically active for 60 minutes on 7 days in the last week. This remains stable from 2018, where it was 22%. And I guess the reason I wanted to highlight this finding is that there has been no positive increase in physical activity since HBSC Ireland has been collecting this data. So it remains around between 22 and 24%. In line with other international research, girls are significantly less likely to report being physically active compared to boys. So 30% of boys compared to 18% of girls, and this drops significantly when we look at the older girls, the 15 to 17-year-old girls. The next is the self-care and sun safety behaviors. So overall, 73% of 10 to 17-year-olds report brushing their teeth more than once a day, which is the recommendation. However, this means that 27% are not brushing their teeth more than once a day. 81% of 10 to 17-year-olds report that they always wear a seatbelt in the car. Again, 19% not reporting that they always wear a seatbelt in the car. And 85% of 10 to 17-year-olds reporting that they always or sometimes use sunscreen on a sunny day. This is up from 80% in 2018. There's significant gender difference here. 80% of boys compared to 91% of girls are reporting sunscreen use on sunny days, and children from higher social class groups are significantly more likely to report using sunscreen on a sunny day. The next section is around menstrual health and period poverty. So like I mentioned, for the first time in 2022, girls were asked about their menstrual health and period poverty. Period poverty meaning ever being unable to afford period products. In the top left-hand corner represents those who report missing school as a result of period symptoms. So overall, 60% of girls who have begun to menstruate report that they've ever missed school as a result of period symptoms. This includes period pain, stomach cramps, moods, etc. And as we can see in this graph, this increases with age. In terms of period poverty, so young people being girls who've begun to menstruate reporting that they have ever been unable to afford period products on more than one occasion, this comes in at 10%. So overall, 10% of girls report period poverty. Girls from lower social class groups are significantly more likely to report experiencing period poverty. This 10% is very much in line with other Irish research around adolescence and period poverty. The next section looks at COVID. So like I mentioned, HBSC 22 was carried out in the spring and autumn of 2022. So young people were just readjusting, I guess, to life back in in-person school. Young people were asked how various aspects of their lives had been impacted by the COVID-19 social and public health measures, lockdowns, school closures, homeschooling, social distancing, etc. So the questionnaire itself asked about 10 areas of their lives. The graph here illustrates from top to bottom the most positively impacted areas. So the top two areas here are the relationship with their family, as well as physical activity. In an international HBSC report, reporting on 22 other countries, relationship with family was also the most positively impacted area of children's lives by the COVID-19 pandemic measures. The most negatively impacted were mental health and school performance. Now, each of these 10 areas are broken down within the report, the body of the report, in terms of both positive and negative, looking at age, gender, and social class differences. So I would encourage, if this is something you're interested in, to please find that within the report. Bullying is the next section that I'll briefly speak about. So in general, 29% of children report being bullied at school once or more in the past couple of months. This remains stable from 2018. It was 30% in 2018. This question in the questionnaire is specifically asking about being teased, being left out, having others repeatedly say or do unwanted, nasty, unpleasant things to them. So what we think is sort of traditional bullying. Boys are more likely to report being bullied in this way. However, what we have seen is an increase in both being a perpetrator or a victim of cyberbullying. So overall, 18% of children report being cyberbullied once or more in the past couple of months. So cyberbullying in the questionnaire is defined as someone sent a mean instant message, an email, a text message, posted unflattering or inappropriate pictures online without your permission, or shared them from others. And this is an increase from 15% in 2018. Girls are significantly more likely to report being a victim of cyberbullying. so 15% of boys compared to 21% of girls. However, it probably is worth noting here as well that the timing of this data collection, in which the pandemic really transformed how young people interacted, with a significant portion of their social lives moving online. So again, this is another area another important indicator to monitor in the future survey cycles to determine this changing pattern of bullying behaviors among adolescents. Finally, finally, looking at the sexual health behaviors, it's worth noting here that these questions in the questionnaire are only asked of children and young people aged 15 and older. So what we're seeing here is 1 in 4 young people aged 15 to 17 report that they've ever had sex. And this remains the same. It was 25% in 2018, 25% in 2022. Of concern, and what we are seeing a change, is there's a decrease in the proportion of young people reporting condom use. Alongside that, we're also seeing an increase in the proportion of young people reporting that they used no contraception at last sex. It was 22% in 2018, and it's now 34%. And boys are significantly more likely to report no contraception use at last sex compared to girls. So I threw a lot of percentages. There was a lot of information there. It is all contained in the report. But just, I guess, in summary, some positive and some not so positive news coming out of today's report. The decreases in tobacco and cannabis use, improvements across fruit and vegetable consumption are positive. However, the overall decline in general health and well-being, the increases in those who are reporting being cyberbullied, as well as the increases in the e-cigarette vapes, and the decrease in condom use among 15 to 17-year-olds at last sexual intercourse. But before I wrap up, just to tell you what's coming next with HBSC. So today we're obviously launching this national report. I'd like to just draw your attention, in June of this year, there will be an international report coming from the HBSC International Network, which will focus on sexual health behaviors. This report is being led by Dr. Andras Couto of the Irish HBSC team. Keep an eye out in the autumn for a trends report. So that will be the next big publication coming from the HBSC Ireland team. We have a knowledge translation desk, so we do welcome people to contact us looking for information about our data and sharing our data. I would just ask you all to just probably be a little bit patient with us at the minute, because we probably get lots of requests over the coming weeks, but we do endeavor to share this data and make this data widely available. I'd encourage everyone to join our mailing list to keep updated, so to hear all the latest news coming from HBSC Ireland. So to do that, you could just email hbsc@universityofgalway.ie, and you can always check out our website to keep up to date with all our latest publications. And I'm not going to go through all of the acknowledgements. The acknowledgements are contained in the report. I guess, like Colette would have said at the start, personally, I'd really like to thank all of the children who gave consent and participated in this study, the parents, as well as the teachers and principals who facilitated the collection of this data in what was a challenging time period. And of course, this report, I had the privilege and the honor of sharing the results and doing the presentation today, but I must thank the research team that I work with in the Health Promotion Research Centre in the University of Galway for all of their efforts to get this report up and published today. So just a reminder to share on social media using our hashtags, and I will finish my presentation now and we will begin the question and answer. Thank you. Now.
Thanks, Aoife. Really appreciate you spending the time going through that, and hope everyone found it really interesting. So we're going to just spend about maybe 10 minutes. I'm conscious of time and people's commitment to other things. So we'll spend about 10 minutes answering some questions. So you're all familiar, obviously, with Aoife, who's just presented it. Fiona's also here from the Department of Health. Dr. Andras Kolto is also on the panel. So Andras is a senior postdoctoral researcher in our research centre. He's worked on HBSC for a number of years as well, and particularly interested in sexual health behaviours and gender and sexual minority groups. So we'll be here to answer some questions. And Niamh Connolly is our communications and marketing manager in our College of Medicine, Nursing and Health Sciences. So Niamh's going to pose some of those questions to us. So keep sending your questions in. And obviously, as Aoife said, follow up with us again through HBSC at universityofgalway.ie with further questions. Thanks, Niamh.
Thanks, Colette. So yeah, lots of questions coming in. I might direct the first one to you, if that's okay. We have been asked, can you tell us how you have involved children in the youth engagement aspect of the study?
Okay, great. Yeah, thanks, Niamh. So in lots of different ways. I suppose for context, I actually chair the youth engagement group across the international HBSC network. So really trying to advocate and I suppose, promote youth engagement across the network. In Ireland, we've been involving young people in our survey for many years. And a number of years ago, we actually had them really, I suppose, revamp the questionnaire. And that was about ensuring that we have questions that are relevant to their lives. So lots of different ways of doing it, using different approaches, methods, workshops, etc. Some people use one panel of young people, for example, but we actually engage with young people at different times and with many different young people over the course of the survey, depending on what the needs are for the survey. So that's worked really well for us. And just in terms of this report, as Aoife said, we had young people sort of help us decide, well, what needs to go into it? What's the priority? Just thinking ahead as well, we have a lot of young people who have, I suppose, put in their ideas for what should be in the next survey round, because we are starting to prepare for that now. And that can be through lots of mechanisms, sending us in, text responses, video, audio, and then obviously in-person events as well.
Great, Colette, thanks very much. Aoife, I might direct the next question to you. This is in relation to, did the research team notice any difference in response options between online and paper and pen? So I think this relates to, this is the first year that we have, the survey was delivered online. So I give that question to you, Aoife, if that's okay.
Actually, if it's okay, I'm going to pass that one to Andras, because he was actually responsible for looking at the differences between the online and the paper. Sorry,
Thanks,
Andras.
no problem.
Thanks, Niamh.
Hi, everyone, and thanks for joining us this morning. And thank you for the question on the paper and online. This was the first time we had used both solutions, and it was at the discretion of the schools whether they wanted to use a paper or online questionnaire. The good news is that we had seen no substantial differences between the two. We also asked the children what device they filled in the survey on, so they could tell if they used a PC, a laptop, a tablet, or their mobile phones. We are about to do the fine analysis on them, so we'll be able to see if there is any device difference, but in general, there was no difference across the different modalities, which is in line with what we have seen in the international practice. Another important bit here is that it seems that the data quality is better if children are responding the online surveys. There is less chance for inconsistent responses, and we had seen less missing. So it seems that the online surveys are better in line, or more in line with children's lifestyles, and probably would be their first choice if they themselves could choose between a paper and an online survey.
Thanks, Andras. That's great. I have another question for you, if that's okay. Are there findings on disability?
Thank you for that question. Absolutely. We asked children if they have a chronic condition or live with a disability. There were 22% of children who reported this. There was no significant difference across genders. We are about to look into those further, and if the person who asked the question is interested in further details, feel free to reach out to us. We also ask about different marginalization and minority group memberships, like if children are member of the traveling community, if they are coming from an immigrant family, if they belong to sexual gender minorities, if they are young carers. We have already published some findings about perceived discrimination and sense of belonging. And of course, what we see is that children who belong to any of the marginalized groups are doing worse than children who are not. And the next step of our inquiry will be to check intersectionality. So to check if any child is belonging to more than one of these marginalized groups, does that make a difference in their health? Probably it's not much surprising that it does. And it seems that the more marginalized group a child belongs to, the worse health outcomes they will have.
Thanks, Andras. The questions are coming thick and fast now. And we might group some in relation to mental health in a few minutes, but Colette, I might come to you first. And do we have an explanation for the increase in children skipping breakfast? A really interesting question.
Yeah, thanks. I guess our survey only asked about whether they do or do not, have breakfast on weekdays. What we do know from, I suppose, international work, the importance of daily breakfast consumption, it is from many different studies linked with, positive, I suppose, school performance, better mental health, healthy weight, those kind of outcomes. So we know it is really important. We haven't asked young people why they've skipped breakfast. We can hypothesize around, I guess, being very busy in the morning. Some people will tell us, that they don't like breakfast, they're not able to eat it. In the past, it has been linked to, I guess, weight control, particularly among girls. But actually, our questions on dieting show, there isn't an increase in dieting or doing other things to lose weight. So we're not necessarily hypothesizing that's the reason. So we've more work to do, really, to I suppose, explain that finding. Yeah.
Thanks, Colette. Aoife, are you happy to take questions on the mental health findings?
Sure.
There are a number of questions. One of the questions was, were you surprised about the mental health findings?
No, is the short answer. So as I mentioned, this is the 7th time that HBSC has been collecting data. And we, in our previous trends report, which would have been published in 2020, I believe, we would have seen a decline in young people reporting on their mental health. I guess it's probably fair to say that the timing of data collection post-COVID probably exacerbated the findings that we're presenting today, but the actual decline and decrease doesn't really come as a surprise to us as the research team, no.
The other question we have, could you share some more information on mental health findings? What was the scale used in relation to happiness, and any hypothesis to give on that?
So the happiness question is actually, so if you remember, I mentioned that there was different types of questions that we ask in the questionnaire. So the happiness question is actually a national question that we've asked in Ireland since 1998. In terms of the WHO-5, so in the report, there'll be a link to that study where it will give you the information about the validation and the use of the scale for adolescents. I guess in terms of implications for policy, I think that's what you asked, Niamh, sorry. I think what's really important is the gender differences that we're seeing in mental health among the girls and the older girls. So the need for probably gender sensitive interventions, perhaps in a school community setting. But as Colette mentioned, the study itself, we don't investigate or we don't ask young people why. It's more just collecting the data around how they feel when they're filling in the questionnaire, and then I guess it's up to us as researchers and policymakers to interpret that and to implement it into good policy and practice.
Great. I think we could be here all day if we were to answer all the questions. It's amazing, everybody's interest. I might come back to you, Andras, and ask you if you can explain and give us some more detail on the sexual health findings.
Thank you very much for that question. The first, we have to emphasize here that the rate of sexual initiation didn't change from 2018 to 2022. So we saw that a quarter of young people aged 15 and up are having had sexual intercourse. But we see that the condom use is decreasing, but not the contraceptive pill. So the changes in the non-contraception are largely due to the decreasing condom use, but not to the fact that sexual intercourse itself decreased. Again, it's an international trend. What we see is that contraceptive use and especially condom use is on the decrease. And we know that the department went at length to have condoms dispensed and give better access to young people to contraceptive pills in the frames of the National Sexual Health Strategy. But the thing is that we need more research, probably qualitative research, to understand whether young people are taking up this, whether it's available for them, whether the vending machines where you can get the condoms are at a convenient place, what are the drivers and the barriers to take condoms actually. So there are a lot more to do, but again, the good news is that there is funding available for such studies, and we are excited to hear more about the outcomes.
Great, thank you. I might open this question, and this is, what do you think explains the increase in loneliness, particularly in females? Who would like to take that one?
Yeah, I can take it. So this is I guess the first time we've included, so it's a new question, I guess, for us in Ireland. And so I guess, and we haven't asked again about why this is the case. You know, we could hypothesize about COVID having an impact, and obviously they're coming back to school. But, you know, it could also be, I suppose, those societal expectations and the maybe biological factors. You know, they can influence, I suppose, emotional experiences among boys and girls, and that may be part of it. But I guess we have more work to do because it's a new item, and I guess more exploration to do around that. And also, as Aoife was saying, looking at those gender-specific maybe interventions or programs, I think that will be really important. And working together with the young people around what they actually need for that and what would work for them, I think that would be vital for this.
Great, thanks. We are running out of time. Colette, I might ask you how the information will be disseminated to children so that they're aware of the results.
Oh yeah, thanks. So we're working on that. We obviously give the report back to schools, but we're not expecting them to give it, or you know, that the children will be interested in that type of a report. So we're looking at a lot of different, I suppose, youth-friendly ways for having a report. And we've been, I guess, discussing with young people around whether there's, you know, interest in more of a storytelling or writing letters. So there's lots of different mechanisms. So that's something that we're working at the moment. Also with, I guess, the international network, who are also invested in youth engagement. So we'll probably do something cross-national as well as do something in Ireland as well, specific for Irish children.
Great, thanks, Colette. I think that's a good place to end, because I think there are a lot more other questions, but we are running out of time, and we have run out of time. So thank you all very much for answering the questions live. And I think if there's still unanswered questions, we might try and get to those after the event.
Okay, great. Thanks, Niamh, for doing that. Appreciate it. And thanks to everyone for all the questions. Really, really appreciate that as well. And we will have the questions, so we will look at those and try and get back to you. But if we don't, please, you know, as I said, send in an email to hbsc@university.ie. So really, I just want to, I suppose, sum up and thank everyone for coming to the event. I think, again, it's testament to people's interest in child and adolescent health, and I think working together to improve children's lives will be really important. And there's so many of you there. I think we can do that. So, I mean, we want the data to be used to inform policy and evidence-based decision making. So that's what we want. So working together to do that going forward, we're all looking forward to doing that. I guess I really want to thank the HBSC team, particularly Aoife and Andras, but there's loads of others. I mean, Aoife put up a list of names who have worked behind the scenes to collect this data. And I really want to, I suppose, thank and just say really acknowledge all the hard work and the long hours put in. Obviously, I want to thank the Department of Health and Fiona for being here as well. We really appreciate their input. And obviously the funding has supported this work for many years. I suppose especially, and finally, maybe to thank the schools, the parents and the teachers. As Aoife has said, they've facilitated us to get into schools, and the children themselves then consented to take part. So we really appreciate their input. So thanks for all of them to taking part in the survey. So we ultimately, we want this data to be used to get out there informing policy, and as I said, evidence-based decision making. So we'll when we log off, we'll start doing some of that work. So thanks everyone for coming. Please do share on your social media or other platforms. We'd really appreciate that, because we want this data to be used by many people. So getting the word out is one of the ways to do that. And finally, to thank everyone for coming, and I hope you've enjoyed the webinar, and we look forward to working together in the future. Many thanks.